from your time working in adult social care, what did you learn about the challenges in the system, and how has that shaped the way you see healing and well-being today?
I think when I was working in workforce development for adult social care, that was my role in local government and when I moved into a national role. And I think at that time, I had a really good overview of what good practice looked like in that sector. And I think I was quite up to date on all of the best practices, both in England and some of the other countries around the world. We were able to, for example, look at Christchurch in New Zealand after the earthquake. Christchurch did an extensive remodel of their health and social care system, and they were able to really integrate it. So it was amazing to see things like that. And then when I dropped down to a grassroots level, I very quickly realized that everything that I'd seen at a national level that was considered good practice, although there were pockets of that, it was actually quite dependent upon postcode as to where that good practice was available. It wasn't available right across the national offering. So I think I had a very aspirational and optimistic view of what could be achieved from the sector to support people's health and well-being. And then as I started to work on the front line, I realized that actually in a lot of cases that wasn't happening. It was hugely dependent on funding and different areas of the country. And then over time, as funding has dwindled and the economic situation has changed, that decline has just got worse. So more than ever now, people are turning towards alternative options. In the past, I think people weren't aware of alternatives so much. And I think now, because they're so desperate to improve their health and so frustrated at waiting times and availability, they are much more open to trying different approaches. And so that's been interesting. And I suppose for myself, I was able to use different approaches at different points in my life, and they've always worked for me. And so I've been able to share that and bring that understanding to the people that I'm working with in Your Vitality Coaching.